Welcome to the oocyte donation program at the Donor Solution. You hold the key to answering a woman or man's long journey to have a child of their own. Why is oocyte donation necessary? For some couples, oocyte donation is the only hope for achieving a viable pregnancy. The following are just a few reasons why a woman may not be able to use her own eggs. She has been through chemotherapy. There's a history of genetic issues in the family. She has advancing age. Or she may have lost her ovaries. Infertility. The facts. Regardless of their medical circumstances, the only goal for these couples is to have a baby of their own to love for a lifetime. These are everyday women, like your sister or your friend. You might ask, what will egg donation do for me? As an egg donor, you will find reward and satisfaction in knowing that your gift of life has had a profound effect on the happiness of another woman and man. Your participation and commitment are valuable. It is with appreciation that we acknowledge your interest. Becoming an egg donor. How can you, a potential egg donor, help? By your interest and commitment, as well as meeting the following criteria, you may qualify to be an egg donor. If you are between 20 and 29 years old, if you have a normal height and weight, if you have an approved medical history, and if you're a college student or graduate. Understanding egg donation. You may choose to be completely anonymous, an identity release donor, or do an open donation. The choice is yours, and we will discuss each option in your interview. The first step to becoming an egg donor is to complete the application. Once the application is accepted, we will make arrangements for your initial interview. After the interview, you may have lab work done to gauge your fertility potential. Once this is completed, we will make your profile available to potential recipients through our password-protected database. Preparing to donate. Once selected for a cycle, you will be seen by the physician and nurses at the recipient's infertility or IVF clinic. You will be advised about the fertility medications you will be taking, as well as how the actual cycle will work in conjunction with their medication protocols. Screening for egg donor candidates. Your physician will ask you about your general health and surgeries, gynecological history, including your most recent pap smear, and your family medical history. You will be completing testing for infectious disease, genetic testing, and some basic blood tests to assess your overall health status. Preparing to donate. It is very important that you discuss with your nurse or doctor about any medications, prescription or over-the-counter, that you may be taking. This includes, but is not limited to, nutritional supplements, herbal remedies, and dietary supplements. Many of these supplements may interfere with lab tests or give false results. An example is the use of CBD oil. It can make the drug screen positive in some instances. Screening. You will also be asked to complete a psychological evaluation that will help you understand more about the donation process from a psychological perspective. This is not a test, but a way for you to voice your feelings and concerns about the donation process in a safe environment. Preparing to donate. The entire donation process encompasses about 6 weeks of planning with about 10 days of actual medication time. You will be taught how to give yourself the fertility medications by the clinic staff. In addition, there are many YouTube videos that can also assist you with the medication administration, and our staff is also available to assist you anytime. Monitoring refers to the blood tests and vaginal ultrasounds that you will need during the time you are taking the fertility medications. These are generally done early in the morning at the clinic to ensure we get same-day blood results and can adjust your medications accordingly. You will have blood tests that measure your estrogen level and vaginal ultrasounds to check the size of your follicles, which contain the eggs. You should expect to have between 4 to 6 of these appointments over the course of the donation cycle. How does egg donation work? When ready to start, your nurse should have your expected donation dates around 6 weeks in advance. You will receive education on what is required of you. Handouts, videos, and other training materials are available. You will receive extensive education on how to properly give yourself injectable medications. Physicians and nurses and our entire team are always available to answer your questions related to administering the medication or any other concerns that you may have along the way. You will start treatment with oral contraceptives or birth control pills. The clinic will not need to see you during this time. You will also take injectable fertility medications. The 10 to 14 day period you're on injectable medications does require frequent monitoring. Monitoring can occur as frequently as daily. Understanding egg donation. Egg donation is always combined with in vitro fertilization, known as IVF. Donor eggs will be substituted for a woman's own eggs. The retrieved eggs are combined with the partner or husband's sperm in the lab by the embryologist. Overview of egg donation. Injectable medications will cause the development of multiple ovarian follicles. Normally, one mature follicle produces a mature egg per month. Medications allow multiple follicles to mature. Through the vagina, each follicle will be aspirated to remove the egg it contains. These eggs can then be donated to a known or anonymous recipient. Anatomy of the ovary. Creating the optimum cycle. This medication synchronizes follicle growth and prevents you from ovulating prematurely. This is not always used. It is started after your initial menses post-enrollment in the donor program. Daily injections are required for 2 to 3 weeks. You may have some side effects associated with the extended use of this medication, but they are generally mild. After your second menses, daily subcutaneous injections of the hormone FSH will stimulate your follicles to grow and mature. How does egg donation work? You will be instructed on any dose changes of the fertility medication after each monitoring visit. Administered by the donor in her own home. It is imperative that this medication is correctly administered. Taken daily for approximately 8 to 12 days. Your fertility is enhanced when taking fertility medications. Therefore, we recommend abstinence or the use of barrier contraception, meaning condoms and spermicide. Monitoring your treatment cycle. Morning monitoring visits include a vaginal ultrasound examination of your ovaries, an assessment of your hormonal status, where a small amount of blood will be drawn to assess your hormone levels and used to determine how the stimulation is progressing. Ultrasound monitoring of egg development. Ultrasound monitoring will determine how your follicles and eggs are growing. The physician or ultrasound technician will insert an ultrasound probe into your vagina, known as a transvaginal ultrasound. It allows the physician to view the follicle growth on your ovaries. This procedure is similar in comfort to a gynecological exam. The final step. Your egg retrieval. Since your egg retrieval is a surgical procedure, you must follow these guidelines. Refrain from eating and drinking the night before. Have someone available to drive you to and from the office where the egg retrieval will occur. The procedure, including admission and recovery, generally takes about 2.5 to 3 hours to complete. Post-retrieval care. On the day of the egg retrieval, rest quietly at home. Exercise should be limited in the days following. You will receive discharge instructions and oral antibiotics. You are still very fertile, so please continue use of barrier contraception. Your nurse will check on your recovery, but if you have any problems, call. If you notice any unusual weight gain, have pain, nausea, vomiting, or bleeding, please call us as soon as possible. You should begin to feel back to normal the next day, and you should expect your next menstrual period in approximately 2 weeks. We are always available to answer your questions. Compensation. We recognize that your participation to be an egg donor is a tremendous gift. It is clearly recognized that your time and commitment should be compensated. Our compensation generally starts at $5,500 to $7,000 for a local cycle in your hometown and can go higher depending on particular circumstances such as location and special characteristics. After every cycle, your compensation for the next cycle does increase. No out-of-pocket expenses associated with the egg donation will be charged to you. Your contribution toward helping a couple achieve their dream of parenthood is priceless, and your time and effort in a donation will be compensated at the completion of the treatment cycle. Final comments. Egg donation allows singles and couples to achieve their dream of having a child. Your compliance and understanding of the procedures allows us to provide the best opportunity for these couples. We want the process to go smoothly, so please ask questions. You can choose to be a known donor, an identity release donor, or an anonymous donor. When we cast our bread upon the waters, we can presume that someone downstream, whose face we may never see, will benefit from our action. Thank you for your interest in being a donor with us.